Let's just double click for a moment on the joint pain. Do we also, in your clinical experience, do you also see a decrease in passive range of motion as well as active? So if you are able to like, let's say it's a head rotation, for example, or even just like a shoulder abduction, is it a reduction in passive and active range of motion as well?
So it depends what we're talking about. I want to frame this in all aging, all passage of time, unless we get in front of it. The good news that is that joint economy and joint mechanics can be completely altered with practice, daily
Yeah.
investment, right? So, but if we don't, one of the reasons you see typical very old people 90 or above shuffling along with very little joint motion, their hips don't move, is because the covalent bonds between tendon and ligament and all the collagen type material in our body get stronger with age. We become more fibrotic, if you will, less flexible.
Yeah.
So that will happen with or without the decline in estrogen. Number one. Number two, what I see with decline in estrogen, now in men, when you look at hormone tables in men, they have an elevated rise through puberty, and then their hormones stay pretty stable throughout a lifetime. Women's hormones are much different. If you look at the life of female hormones, when we're in our 40 years, we're having our period, every month our hormones are going up and down like mountains and
Yes. Every
valleys
day.
every day. But then when our ovaries retire, when they have done their job, there is a precipitous drop. Well, what is the effect on the inflammatory system? Estrogen is a huge anti-inflammatory hormone in the body. It acts on the immune system through a molecule called the inflammasome. Without the intervention of estrogen, our whole bodies increase in inflammation, not just in our blood, but in our joints. So that's why women show up with frozen shoulder, right? It's the most typical presentation. But then women also have stiff hips. They have stiff knees. They just feel tighter than they used to. And that is all because of the inflammatory influence on the soft tissue of the capsule, for instance, in the shoulder. Does that make
Yeah.
sense? Yeah, it's a
Yeah. No, makes
systemic thing.
It's a systemic thing, and it's part of the reason why. I mean, certainly you know this as well as I do, but for our listeners, we know this why there's typically a phasic. We see cardiovascular disease rates in women often catch up to men, but there's a phasic shift. There's a delay in terms of the onset because of that protective effect that, as you're describing, that estrogen has on the body, and in particular, I had Ben Bickman on the show, and he said, up until menopause, women are kind of like metabolic superheroes, and part of that is
Is
because of the
estrogen?
Right. It's because it's estrogen, right?
Uh-huh.
Because we have this cardioprotective, the effect that it has on our arterial walls and the suppleness and the pliability, et cetera. So what you're describing is completely in line with that. And that 80% of women are going to be experiencing one or more of all of these symptoms.
Yes.
We can do better. We should have more, I like the menopause. That's awesome. So we need more practitioners and clinicians in the menopause, or just, menopause literate clinicians who are able to maybe identify or even predict that this might happen. Like 80%, you're going to be right most of the time.
That's right.
And I remember watching, I think it was Oprah who was saying it was maybe late 40s for her, and she started having these heart palpitations.
Yes.
So,
Yeah.
Oprah has access to the best resources
Yeah.
arguably on the planet.
Yeah.
And her cardiologist put her on a heart medication. It's like,
Wow.
I think she was put on I can't remember what she was put on. It wasn't a statin, but she was put on something, maybe for her
To regulate
or
her
something.
arrhythmia. Yeah.
Yeah. And her cardiologist, who was female, missed that it might have been part of a larger picture of the transition from perimenopause to menopause. So I remember when she was saying this, and then she ended up getting on estrogen eventually.
Yeah.
And she was like, it was just like the
miracle.
gods, like the
Yeah.
clouds parted
Yes.
and, the angels started singing. And I remember thinking like, God, if Oprah's doctors can miss it, what
Well-
are the hopes that, the average Jane, right,
Yeah.
is going to be able to get the care that she needs without being herself partially literate
That's
and
right.
her and her doctors. So just wanted to mention that. And then you also mentioned that you yourself at about 47, you felt like you were,
Gonna
being an
die.
athlete for your
Yeah,
whole life, that you felt like you were going to die. Can you explain what is it, some of these symptoms that you're describing? Is
it
that what
is.
happened to you?
Yeah, thank you for letting me tell my menopause story. So, at the time that this hit me, I was not menopause literate. In fact, I knew it was going to happen, but probably not to me, right? I mean, it was just that denial. So, 47 comes
I don't know
along.
what you're talking
I
about. I
have no
never had that
idea.
myself.
Yeah.
Yeah.
Okay,
It's like
not me.
you guys are all
Yeah,
going to go through
that's
menopause, not
right.
me.
Yeah,
Yeah.
not me. So, you know what? I too had heart palpitations at night. And I literally thought that my heart was pounding out. It was chest pain. So I went to a very reputable, I mean, the best at that University of Pittsburgh had cardiologist, and we did a stress test. And he's like, your heart is fine. Your ejection fraction is perfect. And I'm like, okay, I'm not actually dying. So I was having heart palpitations. I was having trouble getting out of bed. I was so inflamed, my whole body hurt. All the things, hot flashes, brain fog. I didn't realize how irritable I was. I thought I was enraged at my job because of my job, but frankly, I had one of the best jobs for an orthopedic surgeon in the country. So all these things that I didn't know, and you're going to laugh, and everybody laughs when I tell them this, but I was an athlete my whole life, so I had long spurts of amenorrhea, meaning I didn't have a period for 6 or 9 months, and I'm like, I'm just so athletic. It's what I do my whole life until perimenopause, and suddenly I had regular periods and they were really heavy, and I felt all the things that all my friends were having. And I thought, oh my God, finally I'm a woman at 47. It
I've
was,
made it.
I made it. It was perimenopause,
Yeah.
right? It was the imbalance of, estrogen versus progesterone. So that's when I did a deep dive and became very knowledgeable in all the things so that I can talk to people not just about the musculoskeletal, but the role of estrogen in prevention of all the things you've talked about, including heart disease, possibly dementia, definitely bone loss, definitely muscle loss. So, I agree with your last guest. We're metabolic superheroes because estradiol is the best biohack our body ever invented.
I love that.